Well, this is a very different year than last year. When we were with PharMerica last year in DC, the big issue for the whole sector, assisted living and skilled nursing, was Medicaid. We were facing the Medicaid battle of our lifetimes, and if we'd lost, the sector would have been absolutely crushed. And so at the PharMerica conference last year, we were talking about that and what the impacts would be and what our strategies were to either shape the legislation to the way we needed it or to kill it. And we kind of succeeded on both. In the House, we were able to shape the bill in a way that would have worked. We got over to the Senate, it didn't work so well. We were part of the coalition that killed it, and we moved on. Everything's different this year. The issue isn't Medicaid, it's Medicare. So Medicaid's not an issue because Leader McConnell and other Republicans have decided that they're just not going to take it on this year, that they don't want to go through the big battle that they had last year and potentially lose during an election year. So they announced in January, no Medicaid battle. So you think, you can breathe easy and it's going to be an easy year, but then lo and behold, Medicare becomes front and center. Now, the good news is that last year we were playing defense. We were just trying to stay alive with Medicaid. This year we're playing offense with Medicare. We're not only trying to defend what we've got, we're trying to make it better. So two issues with Medicare. One is our market basket increase of 2.4%. We were able to get that. Now we're trying to protect it so that on October 1, everybody's payments will go up 2.4%. And then the super big deal is that CMS has announced a brand new payment model that will go into effect October 1, 2019, so about 15 months from now, called the patient-driven payment model. We think if they get it right, it can be really good for our residents and really good for our members. And so we're trying to do everything we can to help CMS get it right. So last year, Medicaid, fight of our lives. This year, Medicare, and hopefully making things better. Well, our lobbying strategy is really twofold. One is rank and file lobbying of members where they're not necessarily leadership on the Hill, but they're members of Congress. We don't take any of them for granted. Obviously, there's 435 of them in the House and 100 of them in the Senate. The advantage that we have is that we have buildings in every single district, obviously every single Senate seat, and so we hit all of those people. And in fact, we just finished our congressional briefing in DC where we had over 400 of our members come to town and we hit every single office. So one part is what I think of as rank and file lobbying of congressional members. Second part, which is perhaps the most important, is intense lobbying of leadership. So while we do lobby everybody, there's about 15 members up there that really control our fate. And that's the leaders of the House and the Senate, both on the Republican and Democratic side. And it's the leaders of the key committees, Ways and Means, Energy and Commerce, and Senate Finance. So we've got about 15 of those people that we are talking to all the time. We're talking to their staffs all the time. We're doing political events with all the time. And so our lobbying is really broken down into those two different categories. Separate from that, we lobby CMS. And I've got to say another piece of good news, which is that the new administration has been super friendly in terms of listening to us. We probably met with the administrator of CMS under the Obama administration during the last 2 years of that administration once. We've already met with Seema Verma probably 10 times. She has been extremely accessible. Now, naturally, she doesn't give us everything that we want, but she listens to us, and her staffs listen to us, and she's directed them to listen to us. And we feel like we're seeing some really positive changes, both on the reimbursement side with the patient-driven payment model, and also on the regulatory side with Survey and Cert. So the lobbying effort's going pretty well. Yeah, workforce is a massive challenge. And it's because the economy's doing great. The government announced last week that the unemployment rate's 3.8%, which is really more than full employment because you have a natural amount of unemployment under any circumstance. And so when we have labor markets like this, and we've had them before, it's really tough for two reasons. First of all, it's just tough to find workers to do the work. I mean, just to find folks to fill your shifts, to not only to meet staffing requirements that might be out there, but more important, just to be able to take care of your people. And that's, the most concerning issue for folks is, can I find the CNAs that I need, the LPNs that I need to actually get the job done? So that's the first problem. The second problem is what it does to labor cost. Labor costs are going through the roof for a couple of reasons. First, people are having to hire agency when they can't fill their shifts, and agency is typically 2 to 3 times what a normal employee would cost. And or they're having to raise wage rates to keep up with what everybody else is doing. And so, as we poll our members, and we do it frequently, the two issues that always surface, or not always, but have surfaced the last 2 years, have been reimbursement, which is always an issue, and then now the labor issue. It's a huge, huge problem. The board recognizes that, is committed to it. We're in the process of evaluating what we hope are real solutions to the problem, and we are going to roll out a package of measures, policies, and tools for our members at our annual meeting in San Diego in October. The question of whether somebody should invest in the long-term care sector right now is a fantastic question, and the answer that I would give them is it depends on a lot of things. It primarily depends on the market. Although things at a macro level look very bad right now, because we hear about these bankruptcies from some of the larger companies. You look at a couple of publicly traded company stock prices, they're very low. There are isolated situations, and it's more than just a handful, where things are better than that. Operating long-term care is very much a market-by-market issue, and it's also driven a lot by state. For the most part, we are woefully underpaid on Medicaid across the country, but there are a handful of states where there's an exception to that. So the first thing that I would tell anybody looking at investing in the sector is they really need to isolate the specific investment, the market that they're in, the business plan for that investment, et cetera. The second thing I would say is that if you have the stomach to wait this out over the long run, this is going to work out. The country is not going to neglect the older population, and the aging of the population, which feels like it's taken way, way too long to happen and to help us out, it's starting to help out. Finally, the number of people that are between age and 80 and 85 is increasing. That will accelerate over the next few years. By the time you get to 2020, 2025, and certainly 2030, we're going to have a lot of people that need our services. This is a super tough time, and so I would, anybody that says, hey, I want to invest in long-term care so I can cash out in 6 months or a year and see how it's going, I would say don't do it. But if you have a passion for taking care of these folks, and you have the discipline and right temperament to be able to handle pretty big swings, I think it's still a fantastic place to spend your career. Well, I'm really happy to be at the PharMerica program for a variety of reasons. There are a lot of vendors out there that make a lot of money by selling stuff to operators, and that's fine. But then there's a smaller number of them that give back, and PharMerica is one that gives back. It gives back by holding this event and hopefully providing education and tools for their customers. And it also gives back by its financial support of AHCA and Cal and all the things that we do. So, I want to be here because I want to be with our members and the operators, but I also want to be down here to thank PharMerica for the fantastic contribution that they make to our sector every single year.